Thanks for joining us. This is the House District 33 race. We're joined by Dr. Maxine Dexter and Dick Quarter. Am I saying your last name
That
correct?
is correct. Thank you.
Great. We'll start with brief intros from each of you. We'll start with you, Dr. Dexter.
Great. Well, thank you so much. This is an amazing opportunity, as always, to talk to you all. I am a doctor at Kaiser Permanente, a mother to a couple amazing teenagers, and a woman who really believes that we all have a right to healthy lives, healthy communities, and a healthy environment. I'm running for HD 33's seat because I believe I have the courage and the compassion to lead so that we can get our working families to the place that we all deserve them to be. And during COVID-19 and tragic wildfires and the air and quality issues that we've had, I can't imagine a better time for a doctor to be in the House. So thank you so much.
Thanks so much. And Mr. Quarter, same question to you.
Yes, thank you. I'm Dick Quarter, of course, and I'm a professional consulting forester. I've actually lived in the Cedar Mill area for, since 1978, whatever that calculates out to be. So I've been in this area for a long, long time. I have been practicing forestry in the state of Oregon since 1969 and working with small industrial, not industrial, but families, small families that own timberland. And my wife and I actually have 3 small businesses in the area. We have the Skyline Christmas tree, the U-Cut Christmas tree farm at the corner of Cornell and Skyline. And we have, of course, the consulting business, which has been pretty much statewide over the years. And we also have a tree farm in the Benoni area, Columbia County area, which we actively manage. It's been in my family for close to 75 years. I was fairly active many, many years in and out of the Washington, D.C. area, visiting and working with congressional members with regards to particularly natural resource types of issues. And finally, about 10 years ago, I said, I really need to get back to Oregon and get things a little better established and working with folks in Oregon rather than going into DC. So I decided to then just actually very shortly before the registration date in March to place my name on the ballot, because I really would love to be able to have an opportunity to work and make all Oregonians feel like they're being heard in Salem. Thank you.
Great, thanks so much. And next question, we'll go back to you again, Mr. Quarter, since you were just talking. If you are elected, what is the first bill that you would like to introduce in the next legislative session?
Well, since we have on our minds the lots of fires that's been happening around the state, it's really devastating. It's somewhere in the neighborhood, last I heard, somewhere in the neighborhood of 1 million acres. So I know that there's somewhere in the neighborhood of 100,000 acres in the state of Oregon that are dedicated common school grounds, and those lands aren't being well managed for the purpose that they were designated to be for. I'd like to work and get some more activity on those lands, get more dollars into the school funds. I also would like to promote more forest management on public lands, including the U.S. Forest Service lands. We've had so much fuel loading in those forests for 30 or 40 years because of non-management activities. We really need to get that under control. Thank you.
Great. Same question to you, Dr. Dexter.
Thank you. So I have several legislative concepts that are in process, and the one that I care most about championing is healthcare reform. Getting rid of the fee-for-service system, making sure that we have a Medicaid public option, and then integrating public health into our care delivery system so that in public health disasters such as we are all living through right now, we can run a coordinated effort across the state to address it.
Great. And obviously, with the supermajority in the legislature, there's a lot of tensions between both sides. I'm wondering, should you be elected, how would you go about reaching across the aisle to work with your colleagues? And we'll start with you, Dr. Dexter.
Great. I have had the opportunity, as you know, I was appointed on June 14th into Mitch Greenlick's seat. And I was blown away by the welcoming collegial atmosphere of my Republican colleagues. I had multiple people in my office in the first couple of days, masks on, of course, talking, really candidly about where we agree and where we disagree. And this is what I do every day as a physician. I take care of everyone, regardless of their politics or their color or where they come from or what they believe in as far as higher powers. And it doesn't matter. We all can connect and we all have aligned values. We want safe communities and good schools and healthy lives. And so I believe that if we all focus on the outcomes, we can get there. And I know that may seem a little bit optimistic, and yet I think now more than ever, we have to work together, and I am dedicated to making sure I do that.
Thanks. And same to you, Mr. Porter. How would you reach across the aisle?
I certainly agree that we all need to work together. And I have absolutely no difficulty in reaching out to all constituents and all legislators. I have a strong history of being involved on the national level, particularly, and on state level as well, in many boards. I served as the Association of Consulting Foresters president for a few years. I was on the National Operating Committee of the American Tree Farm System, which operates like a board of directors, and served on their National Public Affairs Committee and chaired that committee for a while. And all those committees and all those boards are very, very diverse people and individuals across all religions and across all disciplines of politics. So I have no difficulty in working with everyone.
Great. We'll start with you, Mr. Porter, on the next question. Back in June, the legislature passed a series of police reform bills. I'm wondering, what was your assessment of those bills? Did you think that they went far enough in terms of police reform, or is there anything you would do to make them stronger or more effective in the next legislative session?
Well, I certainly am very, very supportive of the police and the work that they do, and it to some degree bothers me a little bit that that suggestion is of taking some of their funds away for one thing. And I heard an interview the other day that there's a suggestion of putting psychologists in every police car's cab, and that the psychologist that was on the interview said that was a very, very poor process to even implement. That puts them in some danger, and they really don't need to be there until that individual is contained and either put in jail system or whatever kind of situation it is. But I am very strongly supportive of police, and I would be very, very supportive of working with and trying to analyze what all the problems are that everyone is expressing and find a common ground between everyone.
Great. And in terms of like tear gas, for example, do you think tear gas should be banned altogether statewide, or do you think police should still be able to use it?
Are you asking me?
Yeah, Mr.
Thank
Yeah.
you. Okay. I guess I have to admit I have mixed feelings about tear gas. I think it's obviously a very strong deterrent to keep people under control. I would actually be more supportive of the fire department bringing in their tankers and using water to keep things a little better in control. If it got totally out of hand, I don't think I'm totally in disagreement with using tear gas I'm certainly very much against all the rioting and looting that we've been experiencing in the Portland area and other places around the country.
Okay, and Dr. Dexter, same to you. I think you were there for that special session, right? What was your stance on that package of police reform bills? How would you amend them going forward? And then also if you could answer that tear gas question too, whether it should be completely banned statewide or not.
Sure, this is such an easy question to answer in just a couple minutes. So what I will say is, first and foremost, I was proud to support the police reform bills. I do think we fell short of our mark as far as wanting to make an impact on what we really are seeing as an impasse in the city of Portland. I take issue with the statement that it's rioting and looting. That is a really rare occurrence, and the rioting is really importantly destructive, and I'm not dismissing it, but I think that's the vast minority of what's out there. I've been out at these protests multiple times and have personally been subjected to tear gas on 3 different occasions and have had significant impacts of that, and know that from people who are out there night after night, standing up for what they have every right to do peacefully as far as their First Amendment rights. They are having significant manifestations of physical harm from tear gas. So I do not believe the use of tear gas is acceptable. I also understand the importance of public safety and the need for police to have usable tools at their disposal to control crowds when necessary. And so I understand the reason that we left in, unless in the case of a riot, qualification with that bill. And unfortunately, I think it's been too broadly applied. We are declaring riots at much too low of a level. When people have signs or are pounding on streets, they're not actually rioting, and they have every right to be disruptive. They just can't be dangerous or at issue of or at risk of posing harm to others. And so I think that the fundamental thing that I believe at this point is that we've got to deal with this on a local level. I had the opportunity to speak to District Attorney Mike Schmidt last week, and he had a really remarkably good idea. Not that that's surprising, but when we were talking, had a great idea about how we can really address this issue on a local level. And I know that the county commission and the city councilors are all talking about this right now. And fundamentally, as someone who represents Portland, I believe it is my duty to be engaged in that, but it also is my duty to support local efforts to come to a bipartisan agreement, because our police have an incredibly hard job and what they do is important. And yet we have got to make room for peaceful demonstrations and protests, because we do have structural racism issues that need to be addressed.
Gotcha. And we'll start with you, Dr. Dexter. What would you say is the biggest issue facing your district right now, and how do you plan to address that in the next legislative session?
Right now, more than anything, people are suffering economically and socially. There were in the in the United States, 865,000 women actually dropped out of the workforce in just September alone. And in that same period, in the ages of 20 and over for men, 214,000. So 4 times as many women almost are dropping out of the workforce. And I see this every day from my colleagues who are professionals who have children at home that they are trying to find childcare, to working families who just can't make ends meet while their kids are at home and have no supervision and no childcare options. We've got to deal with the economic impact of COVID-19 and our closed schools. And that is the most pressing social need for my district. And you see it every day when you drive down I-5 or 405. We've got people who are houseless, and in a time of a pandemic, I find this extremely disturbing, and we've got to address these issues right away.
Thanks. Same to you, Mr. Porter. The most pressing issue in District 33 right now, and how will you address it in the next session?
Well, I think there's at least 2, and there's obviously more, but 2 that I'm very concerned about, and that is, number 1 is taxes, and the other is expensive homes. People are getting really anxious to buy into a home, especially young families, and they're finding it terribly expensive. But first of all, with relative to the taxes, there are several taxes, one of which wasn't passed in 2 different legislative sessions. That's the cap and trade, but the other one was the corporate activity tax, and we were told that that would not be anything but a business tax on corporations and businesses, which most all of us knew that that was not the fact. I have a good friend that just recently told me the story that he just purchased a $15,000 piece of equipment, and much to his surprise, at the bottom line, when he went to write the check, he had to put another somewhere between $500 and $600 on that check in order to pay the cap tax, because it was passed on down to him. And I've also talked with folks that have bought like household goods that have had the same kind of experience with that tax being passed on to them. And so I would work towards working some kind of an arrangement out that individuals would not be taxed through that corporation tax. And I don't quite know how to do that yet. It's pretty tough on corporations to have a 10% on gross sales when their net income, they're very lucky to have 3 to 5% net on their gross sales. So a 10% on the gross sales is very, very tough on them. And I've had also several individuals ask me about expensive houses and how what can be done with that. Well, as you probably remember and recognize, Senate Bill 100, which was passed in the early 70s, has confined growth pretty much in most all urban areas. And the only way we can really sort of get in that under control, if everybody wants to agree to it, is to change some of the rulings and legislation in Senate Bill 100 to allow the expansion of and growth of urban growth boundaries in order to keep the land prices down. That's a tough one to handle, and we don't know exactly where to start working on that, but there's a lot of people that's concerned about it.
Great, thanks so much. So I know we're pressed for time right now. I'm just going to ask the last question. It's our fun question we ask every candidate. We can start with you, Dr. Dexter. What is the most embarrassing or funny or memorable Zoom encounter you've had in the last few months?
There have been plenty of Zoom encounters, that's for sure. The most mortifying one I think that I had was my first healthcare committee meeting, which just happened earlier, just a couple of weeks ago, and my computer was dying, and I felt like I was, I was the new person in the meeting and certainly didn't want to run away to get my power cord. So my husband, who had just finished working out, was in his like completely sweaty clothes and actually didn't realize that he was on camera as he was trying to plug in for me. So that was mortifying.
Okay, and same to you, Mr. Corder.
Obviously, since this pandemic has started, I've had more Zoom calls and participation in Zoom meetings than ever before. I don't even think I knew what Zoom was before. But I think the most interesting and memorable thing is I'd rather be meeting with people in person rather than on a screen. So.
Yeah. All right. Well, thank you so much both for your time. This issue is going to be out October 14th, so keep your eyes peeled. Great.
Thank you very much.
Thank you so much. I appreciate it. Nice to meet you, Mr. Corder.
Good luck, Doctor.
Thank you.